So next up, I'd like to introduce Professor Cliona Ni Mhurchu from the University of Auckland, who's going to move us up into policy. Thanks, Cliona.
Great, thanks, Rachel. First up, a big shout out to all of you who are wearing green today in celebration of St. Patrick and the Irish. Nice to see you in the audience. What I'm going to talk about today is policy approaches and the evidence underpinning recommended policy approaches to obesity prevention. I've only got a very short time to talk about that, and as you can imagine, it's a huge area, so it's going to be a really quick run through of some of the most recent guidance that's come out around obesity prevention and looking at the alignment of recommendations across some of those guidelines. And then I'm going to look briefly at our New Zealand Childhood Obesity Plan and how that compares with some of the international guidance on preventing obesity. And then I'll just finish by maybe covering some of the areas where there are some gaps in terms of evidence and perhaps some opportunities to strengthen the work that we're doing in this area in New Zealand. So I mentioned that there is a lot of evidence-based guidance. In fact, there's a plethora now, and these are just a selection of some guidelines that have emerged just in the last couple of years. So many of you will recognise the WHO Ending Childhood Obesity Report, which came out at the beginning of last year. There was also the Lancet Obesity Series published in 2015. The McKinsey Institute has published an economic analysis of the most cost-effective ways to tackle obesity. Here in New Zealand, the New Zealand Medical Association has also published a policy document, and the OECD too. And in line with what Louise was emphasising earlier, all of these policy documents emphasise that we need action across multiple domains. So yes, we need to be looking at diet and physical activity, we need to be doing it across the life cycle, we need to be looking at prevention, and we need to be looking at management. And action is also needed by multiple sectors. So whilst often there is a tendency to either focus on individuals or industry or government, there's a recognition that all sectors of society are going to need to work together to tackle obesity and to, if we are going to have any chance of reversing the epidemic that we have at the moment. So what I did was just have a quick look at those 5 policy documents. Apologies for the very basic presentation, but those 5 guidance documents to look at what were some of the key policy recommendations in those documents. Now, obviously, a lot of them make other kinds of recommendations as well around industry behaviour, individual behaviour, and so on, but I was really just focusing on the policy ones. And I think what you can see is that thankfully, given that these are evidence-based documents, there is in fact remarkable consistency in the recommendations that are coming through in all of those documents, and particularly around the 4 recommendations that you can see highlighted there in red. All 5 of those guidance documents recommend a sugar-sweetened beverage tax, to limit the marketing of unhealthy foods to kids, and to implement a simple front-of-pack nutrition labelling system. And 4 out of the 5 recommend having having standards around healthy food in public sectors and schools. Many of you are aware that New Zealand does have a childhood obesity plan that's been in place for over a year now. And you can see that it's broken into targeted initiatives for children who are already overweight and obese, increased support for children and families who are at risk, and then broad population approaches with a view to preventing obesity across the population. The colour keys show that the responsibility for these actions tends to lie across multiple sectors. What you may note is that some of the population approaches in New Zealand, many of those fall under the arena of industry, and I'll talk a little bit more about those shortly. So how does our New Zealand childhood obesity plan compare with those policy recommendations? So we can see that pleasingly it is aligned with most of the common recommendations, particularly around restricting marketing of unhealthy foods to kids, implementing a simple front of pack labelling system, and there is a recommendation in there to introduce standards around a healthy food policy. But in New Zealand, the focus is on hospitals and district health boards rather than schools. So what are the differences between the guidance and where we're at? Well, you'll have noticed that there is no sugar sweetened beverage tax in our childhood obesity plan, despite the fact that it was recommended consistently in all 5 of those guidance documents. There is a front of pack labelling system being introduced, which is great, and the ASA has undertaken a revision of the advertising code, which is also promising. But it's worth noting that these are voluntary initiatives, and they are, in the case of the advertising code, being led by the industry. In the case of the front of pack labelling system, there is joint leadership between government and industry on that system. And the other thing that is noticeable by its absence is the fact that there's no recommendation for a healthy school food policy, but I would hope that with the development of the healthy food policy for DHBs, that might be an opportunity to build on that and roll it out to our schools. So why the focus on SSBs? I really don't want to focus on this too much because many of you will have been at the debate last night and most of this was covered in detail then. But apart from just being recommended in guidance documents, this is a policy that's being implemented in many, many countries around the world. And apart from those where it's already been implemented, there are a number of large countries who have already announced that they're going to adopt it, and several others who are in the process of actively considering it. Again, last night we heard some discussion around the evidence around whether these taxes actually work. Some of the best evidence that we have is coming from Mexico, which introduced their sugar sweetened beverage tax 2 years ago. A year ago, they published some data in the British Medical Journal, which showed that consumption of the taxed beverages had decreased over a 1-year period, and consumption of untaxed beverages had increased. More recently, they followed that up with a 2-year analysis to show that that reduction in consumption has continued into the 2nd year. So where are we in New Zealand with this? Well, again, there was a bit of debate around ideology and how ideology plays out in these debates. We have seen, I guess, a certain polarisation around ideology around sugar-sweetened beverage taxes in New Zealand, as you can see from various reports. The public health sector is very much in favour of implementing it. The government is being more cautious. What is interesting in this is, I guess, what is considered sufficient evidence to introduce a policy like this. So the 5 guidance documents that are recommended, or that have recommended an SSB tax, believe that the evidence is currently sufficient. At the moment, the status in New Zealand seems to be that the evidence is not sufficient. So I guess there is a question over what is really considered sufficient evidence to introduce a policy like that. An important point to remember with something like an SSB tax is the fact that the revenue can be recycled. And a really good example of that is in the UK, where they've announced the fact that they're going to introduce a tax on sugary drinks, and they've made it explicit that the revenue from that tax is going to be used to fund sport in schools. So a really positive benefit that will come out of the revenue from that tax, and we know that framing these kinds of initiatives in a way where there is a positive public benefit that's tangible to a lot of people is really important. Some work that we did a few years ago suggests that New Zealand, if there was a tax on sugar-sweetened beverages, the revenue would be anywhere between $30 and $40 million a year, depending on which category of sugar-sweetened beverages were actually taxed. So that's a substantial amount of money that could be reinvested for health in New Zealand. Going to talk very briefly about front-of-pack nutrition labels. Both Australia and New Zealand have adopted the Health Star rating system, which is an interpretive front-of-pack labelling system to help people better gauge how healthy the foods they are that they are consuming. The purpose of these systems is really often the primary purpose is to inform consumers so that consumers are better informed about what's in their food and can make more informed choices. But we should also remember that these systems are very effective in encouraging and incentivizing industry to reformulate foods and make them healthier so that they can get a better label and a better star rating on their products. We were interested in whether these kinds of simple interpretive systems like the Health Star rating system and the UK traffic light labelling system, how effective they are in encouraging consumers to buy healthier foods compared with a traditional non-interpretive label like the Nutrition Information Panel. So we conducted a large randomised trial. The protocol was published a few years ago, and the results were just published last month in the American Journal of Clinical Nutrition. What we found is that in the trial that we ran, which involved more than 1,300 New Zealanders, and they were randomised into those three groups that you saw in the previous picture, that use of nutrition labels is pretty low. People don't use them a lot, and certainly in the trial, the use of the label of all of the labels was low. However, we do know, and the trial reinforced that people prefer interpretive labels, whether they're traffic light labels or Health Star labels, it didn't matter. They like them, they can use them more easily, they can understand them better. And what we did find is that for people who use labels frequently, that it does seem that those interpretive labels like the star rating and the traffic light labels do actually lead to significantly healthier purchases. So overall we found no significant effect, and I guess I raise that as just the fact that we should be mindful of the fact that a nutrition labelling system is not going to have a very large impact on consumer behaviour at a population level, but it is likely to have an impact in a subset of the population who are particularly motivated to use those labels. I did mention before, though, that these systems can lead to healthier product reformulation, and in fact we have just completed an evaluation of the impact of the Health Star rating system on product reformulation in New Zealand. The results are currently under embargo until a ministerial meeting next month, but they will be publicly released then, and I would say that they are positive. So it does look like the Health Star rating system is promoting healthier food reformulation. I'm not going to dwell on marketing because Louise has covered this area in depth and has mentioned the fact that we have a revised code. But I think that a question remains in terms of how effective this code will be, given that we know that voluntary industry-led initiatives have very limited impact generally in terms of population effects. And I did mention that the Ministry of Health, in conjunction with a whole network of DHBs, has developed a national healthy food and drink policy for DHBs. It's not yet implemented, but the policy's been developed and it's available on the Ministry website. I think this is a fantastic step for New Zealand to have guidance and a policy in place around selling healthier foods and drinks in our hospitals. It is my hope that it will be the basis for similar policies in other public sectors, but particularly in schools where the menus for tuck shops are, as you can see, not exactly what we would hope for in a healthy food policy. So those here you can see my key messages, but actually I too was struck by what Minister Goldsmith said. Lisa already quoted it around it's one thing for scientists to know what's the best thing to do. It's another to persuade others to do it. He was thinking about the public, but I was thinking about policy. And many of you will know Kelly Brownell, who's a very influential scientist around policy, food policy. And he had an editorial in The Lancet called Strategic Science with Policy Impact. And I just want to quote a small bit from it. It says, "Only a small proportion of research has the policy impact it might have. Most researchers are not trained to create policy impact from their work. Engagement with policymakers is not encouraged or rewarded, and communication of scientific findings occurs rarely outside of the academic community." So his recommendation was that strategic science with policy impact, it requires communication of our evidence more effectively to policymakers and for scientists to be aware of the important questions in the policy world. This process begins with better information flow between scientists and change agents. He made a number of other recommendations, but I think perhaps in line, or at least aligned with what Robert said. I take your point, Robert, about the fact that we have to be selective in our focus, but I think we also need better communication with the change agents for policy. Thank you.
Thank you very much, Cliona, and it's great to see some people from the Ministry of Health and policy-making organisations here today, and that's one of the real strengths of these symposiums, is that we try and encourage a wide range of people to come. Time for one question or comment? Yep, just there.
Do you think food industry is better at capturing ministers' ears than the public health?
I think food industry certainly have a lot of influence on governments around the world. That's well known. They are a powerful determinant of our national economy, and they have deep pockets, and they are very good at employing lobbyists and people to act on their behalf. Public health obviously is more challenged in the sense of not having the same kind of resources at our disposal. I think perhaps we've also suffered a little bit from being a little siloed and perhaps divided in what we are recommending. And again, going to what Robert said, I think we need to be speaking a little bit more with one voice. Food industry is excellent at speaking with one voice. They have key messages that they repeat over and over and over again, and actually I think public health could learn a lot from that.